many different ways to position our patients for dental radiography. Today we're going to keep our patient in sternal recumbancy for the maxilla. This way, if we make sure the palate is parallel to the table, we can use a set angle that will work for every single patient every time. This makes us a lot more efficient.
Dental radiography is absolutely a must-have to properly diagnose and treat oral disease. Digital dental radiography allows us to view the image as soon as we obtain it. So if we need to make changes in positioning or we need to get additional area around the apex of the tooth, we can make those changes immediately.
So Tammy, now that we have our patient under anesthesia, what do we do next?
So we're definitely going to proceed with our full mouth x-rays, just get everything started. We do already have our patient ready, so his head is nice and level and even from side to side. When we do our radiographs for the upper jaw, we want to make sure that our trach tube tie is not in the way of our radiographs or getting on top of our sensor. So we can either tie it under the jaw or behind the head. So now I'm going to go ahead and place the sensor. We want to make sure he is fully under anesthesia so we can see he has no palpebral reflex and he's got loose jaw tone. So that means we can be comfortable putting this in there and know that he's not going to bite it. So I'm going to go ahead and lift his lip. I'm going to slide the sensor back and I'm going to place it underneath the first molar. We do want the sensor to be nice and flat, and we do have it already wrapped with our vet wrap. We're going to make sure that the crowns of the tooth are on the edge of the sensor, and that gives us the most sensor real estate to the inside of the mouth. So our angle is set at 50 degrees. We're going to go ahead and move our tube head into position with our patient. We know that these teeth are directly underneath the eye. That's why those abscesses come up in that area. So we're going to start off kind of in that range, and then we just want to rotate so that we're coming from behind. And this will help us get an image of those molars. And then we just want to lift our lip again and ensure that our beam is going to expose our entire sensor. So now we're ready to take our x-ray. We want to make sure that we're 6 feet away for safety, so we'll step out while we expose our x-ray.
As with standard radiation, we want to make sure that when we're using digital dental radiographs that we use precautions to limit our exposure to radiation. We want to stand at least 6 feet away from the x-ray tube head. We want to stand behind the x-ray tube head, so we want to stand behind the direction that the x-ray tube head is pointed toward. If we can't stand 6 feet away, then we need to use the same precautions as we would with standard radiographs. We need to use a lead apron and a thyroid shield and lead gloves.
So on our image, we got an image of both of our molars. Now we'll make that larger so we can see it. So we did not image our fourth premolar, but this is a larger dog, so that's not totally unexpected. So essentially we can see our roots here, and we know that we are more than 2 millimeters beyond the apex, so we would call this a diagnostic x-ray, and we can move forward with our next image. So now we're going to reposition the sensor to make sure we get an image of that fourth premolar. So we're going to make sure that our sensor is positioned with the back part of it just touching that first molar. The longer axis is going to be along these premolars. We want to make sure that it's not hanging out this way, but that all the sensor is pushed in so that the crowns of the tooth are along the edge of it. Then we're going to basically have the long axis of this sensor available to image this tooth. So now we're going to rotate our tube head so that it's straight towards the eye, and then we're going to rotate it around behind. So we want to be 1/4 to 1/2 inch behind the lateral canthus of the eye, pointed at the opposite corner of the nose. And then again, I always like to flip the lip and just make sure I'm going to expose my entire sensor, and we're ready for the next x-ray. So now I'm going to make that image larger so that we can take a good look at it. So you can see that using this view has pushed this root out from underneath this molar so we can really evaluate it well. And it also split our two front roots apart so we can evaluate them separately.
One of the advantages of digital dental radiography is that as soon as you expose the image, it's visible on your computer screen. And so therefore, when you look at the image, you can make sure that it's a diagnostic dental radiograph. If for some reason you've cut off the apex or the tip of the tooth on that image that appears on your computer screen, you have the opportunity to make that change immediately. So don't take a dental radiograph and then go immediately to the next image without evaluating the radiograph that you've just obtained.
So now we're ready for our next x-ray. We're going to move on to image the first 3 premolars. So again, we're going to pull our tube head back a little bit so we can get in here and see. And we're going to slide our sensor further forward here. Make sure that, again, it's under the leading edge of the crowns. Sometimes it can help to move your trach tube a little bit underneath it and kind of help it hold the sensor in place, which is what I just did there. We're going to shoot this particular shot at 45 degrees. So we're going to turn our tube head and we're going to adjust it to 45. We're going to change our tube head angle to 45 degrees and then we're going to move it into position. We want to make sure that this wire's not getting in our shot as well. So we can bring our tube head in straight lateral. Those teeth are in a nice row and those roots go right up laterally so we can come from this angle. So again, we want to make sure that our sensor hasn't shifted. And now we're ready to expose the next image. So we did a great job of imaging the first and second premolar. We've got plenty of space beyond that. And we have a great view of this mesial root of this third premolar, but we didn't quite get all of our distal root. And this is a good time to talk about how we might want to fix this. So what I'm going to do is actually just move my sensor a little further back. So what we really want to be concerned about is making sure that we get a good image of the part that we missed. So I'm just going to reach in here and essentially slide the sensor further into the mouth or closer to that fourth premolar, which is more underneath the root that we didn't get a good image of. Now we're ready to take our next image. So our image is available now. I'm going to go ahead and make it larger again. And we can see that just that slight shift with the sensor got us a great image of that root that we missed in our previous image. So now we're ready to work on canine teeth. So now we're ready to image our canine tooth. So the first thing we want to do is adjust our sensor. So we are going to slide it even a little bit further forward, but we still do want to have the crowns of the teeth along the edge of it. Since Major is a good sized guy, we want to stay behind the canine, which means we're not going to get an image of the crown of this tooth. Because he has some damage to this tooth, we are going to have to go back and make sure to get an image of this so that we can evaluate that on radiograph. But for now, we're going to concentrate on the root. So we want to make sure that our sensor is positioned underneath the crowns of these premolars again, but we want to move it up until it's closer to this canine. So we're going to make a 90-degree angle between our thumb and forefinger. I'm going to lay my thumb along the center line or the bridge of his nose, and my index finger is going straight out. We're going to use this as a guide for where the root of that canine tooth goes. We want to set our angle for 60 degrees, so like that. And then we're going to put the tube head and basically point it right into the corner of my fingers. And when I pull my hand away, we should be aiming towards the medial canthus of his eye. So now we're ready for our next image. So I'm going to increase the size of this image so we can evaluate it. So we got a great view of the tip of the root. We can see way beyond it. We didn't quite include all of what's below the gum line, but we'll hope to get it with our crown image when we take it. So we want to move the sensor forward so that it's going to be underneath the crown. I really like to use tongue depressors for positioning because it helps hold our sensor flat. So if I take my tongue depressor and basically put it underneath the canine teeth and go from side to side, it keeps that sensor nice and flat. So then I can position it so that the crown of this tooth is on the corner of the sensor, and then we can get an image of that crown and hopefully that little bit of bone that we missed on our previous image. So now we can bring our tube head back in and get ready for our next image. So we can pull back into the similar location that we were in before. And again, we just want to make sure that our sensor is fully in the beam. So now we're ready for our next image. So our next image is available to view. I'm going to go ahead and make it larger so we can get a good look at it. So we can see that we did get the entire crown except maybe for a hair here, and it did include that section of the bone that we missed on our previous image. So now the veterinarian can evaluate those areas where there's some wear on the teeth. And now we're ready for incisors. So we're going to move our sensor. Because again, he's a larger patient, we know that we're probably not going to be able to get an image of all 6 of our incisors together. So we're going to plan to do them 3 at a time. He's wide enough here that we probably don't need our tongue depressor anymore, so we can place our sensor directly underneath the incisors. And I usually, if I'm doing them 3 at a time, I will just rotate the sensor a little bit to the side that I'm imaging. If we were trying to image all 6, we would want to have the sensor be perfectly straight. So this image we also take at 60 degrees where we took our canine tooth, so we don't have to change the angle of the tube head at all. And we can bring this down. And again, if I was trying to get an image of all 6, I would want to be straight and centered. But since I'm going to only get the 3 incisors on the right side, I'm just going to come ever so slightly from the right. And we're ready for our image. So we'll make our image a little larger so that we can evaluate it. So here we have our 3 incisors that we were looking for. We could be really, really critical and say that we really kind of clipped the corner of that, right? We didn't quite include all the bone that's below the gum line. Our choices for this to make an adjustment would be to rotate a little further from the side just to acquire that section that we missed. So we'll go ahead and do that. So we're just going to adjust the angle of our tube head so that we can move a little bit towards the section of the tooth that we missed. We're just going to come around from the side a little bit further. Now our image is available. So we can see that now we have the complete picture of that tooth.
When obtaining dental radiographs, we can either take radiographs every time it's indicated, so anytime there's a fractured tooth, mobile tooth, gingival recession, worn tooth, oral mass, or we can take x-rays of the entire mouth, all 42 teeth in a dog and all 30 teeth in a cat. The advantages of taking full mouth dental radiographs is that we're going to see pathology that we otherwise wouldn't find. So I could look with my eyes at a tooth that looks perfectly normal. It's not fractured, it's not discolored, there's no gum recession, there's no oral mass, there's no tooth resorption, and it looks normal to my eyes. And if I'm not taking full mouth x-rays, there's a possibility that I could miss pathology that's around the root that I can't see with my eyes.
So normally at this point, if we were taking full mouth radiographs, we would want to move around the other side of the mouth. For the purpose of this instruction, we're going to move on to imaging the mandible, so we need to reposition our patient.